Hey everyone, my name is Justin White. I'm the CEO of Senior Health Services. We're going to talk about Part D today. And the reason for this is that if you haven't heard yet, you're going to very soon. It's going to increase the cacophony throughout the course of the year of changes that are likely coming to everybody's plans for next year. And while we can't talk about specifics yet, because frankly, we don't know what they are, the carriers are working on these behind closed doors right now. I can at least show you what the drivers of the changes are going to be or are right now by things that are already in the public domain. And then we can do a little bit of conversation and speculation so that you at least have some information to plan. I don't think it's fair to foist all this stuff on you because we can't even tell you about the specifics until the 1st of October. I just don't think that's fair. You guys need to have some and deserve to have some information so that you can at least ponder what's likely coming down the pike so you can plan. Is that fair? So I want to share my screen here real quick and let's talk about a couple of things that are coming out. And we're going to start on the CMS.gov website. CMS is the acronym you see there for Centers for Medicare and Medicaid Services. It's like saying Medicare. And we're going to look at the changes that are coming down the pike. This is on their website. Thus, it is in the public domain, and thus we are allowed to talk about it. So if you come down here, this is an article called Part D Improvements. So it is a victory lap of sorts. And they're throwing out the things that they're bringing to the fore. And I do want to start off with something positive. There's a lot of positive that's here, but there's things, again, that you need to consider. The Part D improvement right here, Medicare Prescription Payment Plan. I really like this. And you'll see here, for the first time beginning in 2025, the drug law known as the Inflation Reduction Act is going to allow people to spread the annual cost of their medications evenly throughout the course of the year. Isn't that nice? So no more going to the pharmacy in January and having to pay so many hundreds of dollars because of the deductible and all that kind of stuff. And then you got the numbers are always different every single month. They're going to allow you to look at the estimated drug costs for the year and then spread them through the year in even capped monthly amounts, which I think is great. In fact, they should have done this a long time ago. So that's coming to a pharmacy near you in 2025, starting in January. I think that's really good. So this is all part of the Part D redesign. They're actually redesigning Part D. And so I want to focus on some high level things. I don't want we can go in. If I open one of these links that are right here, it's like dozens and dozens of pages and wow. So we're going to look at the basic structural elements so I can show you what's changing and what you can expect to see when the changes do start filtering through. So you'll notice here, thanks to the Inflation Reduction Act in 2025, annual out-of-pocket costs will be capped at $2,000 for people with Medicare Part D. Okay, that's a decent cap. This year, 2024, the threshold is $8,000. Now, that represent the dollars that actually come from you, the beneficiary, is somewhere around the $3,300 range. But when you do the formula, it's actually an $8,000 range, but the actual out-of-pocket fee is $3,300. So you can, those of you that are on the really expensive brand name drugs can see your liability dropping from a maximum of $3,300 usually down to a $2,000 maximum out-of-pocket. So you say, so that's fantastic, right? So everybody goes, well, I thought you said this was going to be problematic. So what's the problem, man? So I'm going to show you. So you can see this is on the Kaiser Family Foundation. This was an article that was actually published showing the basics of the Medicare drug law changes back in April of last year. So this has been out there, but nobody really talks that much about these things. Now you can go search for it and you can read this in full if you'd like to. But this shows the changes to this year and next. And I want to point out here a couple of things. We're going to skip some of this stuff. The drug Part D, what a complicated structure. I know a lot of people watching this goes, man, you said it. But I want to show you this. In 2024, the catastrophic threshold will be set at $8,000. This amount includes what Part D enrollees spend out of pocket plus the value of the price, the manufacturer discounts. So it says here, at this amount, Part D enrollees who take brand name only drugs will have spent about $3,300 then to reach that threshold. Right. So that's where I came up with that $3,300. And then next year it's going to be capped at $2,000. So you see a $1,300 potential savings, which is great. Okay. Nobody's arguing that. We want to see people spend less on medications because it has been ridiculous in recent years. I think everybody can agree with that. But let's scroll down here and I want to show you where the problems are going to come in and why the carriers are worried. Because when the carriers are worried and they're trying to figure out how to make all this stuff work, that's when you need to be concerned, at least aware, so you understand why the changes are coming and what's driving them. So look at this 2024 right here. And remember, the catastrophic coverage is the level at which beyond that, your cost goes to zero. So the Part D plans are paying 20%. So whatever the name of the carrier, the company is on your card for your drugs, they are paying 20% of the catastrophic cost once you hit that level, and Medicare pays 80%. Okay. So that's all well and good. And that allows you to pay zero. But look at 2025. The catastrophic coverage level, look who's paying and look how much. The carriers, the name of the company that's on your card is going to have triple the liability. They're going to go from 20% to 60%. And then 20% is going to be a discount from the drug manufacturers. And then Medicare is not paying 80% anymore. They're paying 20%. So the liability has been shifted onto the carriers and away from these other entities. These manufacturers are going to come in and do a little bit, but it's mainly going to be shouldered by the insurance carriers. And if you've been watching the news this year, you know some of the largest carriers in the country have already warned about earnings challenges that they've had. And some of them have adjusted them several times this year, some recently. So they're already having problems, and that is before this came through. So this coming year, they've got to figure out how they're going to adjust for triple the liability. Now, as you might imagine, you might think, well, maybe the government has passed more legislation to get more money to them. As far as we know, that has not happened. Now, this election year, crazier things have happened. But as far as we know, they have to deal with the same funding they have now to cover triple the liability on the drug cost, which is one of the larger costs that Medicare has to deal with, are prescription drugs, as you might imagine. So they've got to go in and make adjustments to the existing plans. And that's what's driving what you're going to hear more and more and more about, and what's going to be reflected on your annual notice of change that comes out towards the latter part of September, showing the changes that are going to be coming to your standalone prescription drug plan or your Medicare Advantage plan that includes drugs. Make sense? Now, what could those changes look like? If they're having to change the existing benefits, it could include having a premium all of a sudden appear where today there is no premium. It could mean that the copays go higher, or the maximum out of pockets go higher, or portions of certain things, the coinsurances will be at a higher level for certain benefits. Or like last year, a lot of carriers came in and reduced or eliminated their transportation benefit. That was getting ready for this. It was a small change made to get ready for this stuff. And so it could literally be that. Some of the extra benefits that have been enriching so much in recent years, you may see those being drawn back while the carriers look around to find money to cover this additional liability that they have coming down the pike. Does that make sense? So as you're looking at this, I just want to make sure that you're aware of what's going on and that you understand why the changes are coming down the pike. As they roll out, we're going to get whispers, and I'm going to talk with people, obviously, in the industry, and I'm going to know more. And to the extent that I can share it, I'll come back on here and share with you. And then we're going to learn together exactly what those changes are as they come and solidify in late September. And then we can actually talk with you specifically about them one-on-one after the 1st of October. Okay. I hope this is helpful. I hope you appreciate getting this information. And again, I'll roll out more topics and things like that as we go down the pike. But my name is Justin White. My company is Senior Health Services. We've got ways that you can get in touch with us on this site. Please call us if you need any help or have any questions, and take care. Bye-bye.